So there's another modality which we actually use in treatment of pressure in joints, and this is what is known as a joint aspiration. So if there's too much pressure in your joint, they might actually want to like extract some fluid. So if they extract some fluids in the joint, this helps to relieve the pressure. Alright, so joint aspiration is also known as what? Arthrocentesis. It's a medical procedure. It's used to relieve pressure, relieve pain, and also swelling in the joint. Of course, you are doing it because you want to actually remove some fluid from the joint. Okay, so it's commonly performed on joints like the knee, the elbow, the shoulder, the ankle. So why is it done? Might be done to relieve the pressure that is building up from accumulated fluid, also reduce pain and swelling in the inflamed joint, diagnose joint condition. Sometimes you want to actually remove some of the synovial fluid so that you can be able to go and send it to the lab to be able to diagnose some issues. Okay, also administering medications directly into the joint. Sometimes I'm not only aspirating. After aspirating, I can send some medication so that the fluid buildup is not over and over again. All right. So what causes the fluid buildup that we're trying to treat using this arthrocentesis? So excess fluid in the joint can result from things like injuries or traumas. Could be inflammatory conditions, could be infections, could be degenerative diseases like all those osteoarthritis. Then sometimes it's because there's kind of like some bleedings into the joint. That's hemarthrosis. Okay. So how the procedure works: preparation, the area is cleaned and numbed with local anesthetics. Aspiration, the sterile needle is now inserted into the joint space. Then fluid removal, the fluid is drawn into the syringe. Okay, this will reduce the fluid. This will also relieve the pressure. Okay, so optional injection. Sometimes you have an option of sending drugs back into the joint. Okay, of course it will be primarily drugs that can be able to handle drugs that can be able to be used to treat inflammation. That's all those corticosteroids, non-steroidal anti-inflammatory drugs. Okay.